Hello, everyone. I'm Portia Grigsby. I am your host. I'm also the executive director of Black Girl Health Foundation, an organization geared to improving the health of Black women and children. And I'm excited for another annual event of I'm a Survivor. This is all about breast cancer awareness, especially spreading awareness about breast cancer among Black women. I am so happy to be able to create a platform where women and survivors can share their stories of struggle and their stories of resilience. And I hope, hearing these stories that you'll hear today, I hope that it's motivation to keep going. If you are struggling, if you have been diagnosed with breast cancer, or be a support network for someone that you know. You will hear those stories today, and then you will also see celebration. And so we have a lot of upbeat workshops today, yoga and Zumba. We have those things because there are stories. I mean, this is a celebration. It's a celebration of survivors and their resilience to keep on going, to persevering and pushing through. And I hope that that is motivation for a lot of you. This is a sisterhood. So we're here as a support network to help each and every person struggling. And it may not always be breast cancer, it could be anything. And that's what we're here for. So I would like to, before getting into the stories and the workshops, I would like to thank our sponsor, MD Anderson, for supporting us for another year in a row. We appreciate your support, and we couldn't do it without you. So again, thank you again, MD Anderson Cancer Center, for your support for for I'm a Survivor. So the workshops that we have this year, we have our yoga workshop, we have our Zumba workshop, and then we have our workshop in particular is sponsored by MD Anderson Cancer Center. Dr. Tanya Mosley is going to be talking about breaking down those barriers and everything, talking about everything Black women should know about cancer. So this is also about prevention. It's not too early. It's not too early to be able to self-examine yourself, to pay attention to your body, to know what's going on, to get screenings. All that stuff is very important to be self-aware, and that is a big takeaway that I hope that you get out of today. All right. We have amazing presenters, Marsha Banks Harold, who's doing yoga. We have Donna Ward, who's doing Zumba. And again, Dr. Tanya Mosley with MD Anderson, that is going to be doing the workshop on everything women should know about breast cancer. So without further ado, I'm going to go right into our first testimony of the day. You're going to hear a lot of these testimonies of women who are surviving breast cancer. And we're going to go to the very first one right now.
Hello to this amazing audience that Black Girl Health has assembled. My name is Marika Cole, and I am a stage 2 invasive ductal carcinoma breast cancer survivor of 3 years. Hallelujah. I was diagnosed in 2020 during the pandemic at the age of 36 years old. After I was experiencing a scab on my nipple that wouldn't heal, I went and got it checked, and I also felt a lump there as well. And it was confirmed that it was, in fact, breast cancer. I was a full-time working mother, taking care of my 4-year-old son when life had to take an unexpected break. I'm thankful that I was able to take off of work for 10 months. I had short-term disability, and also I had life insurance with living benefits. So I then gradually went back to work and thankfully was able to go back to work full time. I had chemotherapy, 6 rounds. I had a double mastectomy, unable to save my nipples, and I also had 28 rounds of radiation. After all of that, I became a breast cancer advocate, advocating for young and minority women under the age of 40. As an advocate, I teach other survivors, caregivers, and community members about the importance of breast cancer awareness and early detection. I want you all to know that in this journey, you're not alone. Don't try to go at it alone. Please join and embrace this community that chose us to be warriors. We will overcome whatever comes our way one day at a time. Thank you all for your time. Thank you so much for your time, for being here. And I pray blessings and great health over all of you. Goodbye.
And that was, again, Marika Cole. Thank you so much. As you can see, that these are stories of, young people who look just like you and I, happen to any one of us. And it is totally an inspiration, and it gives, I hope that these testimonies that you see allows you to really self-evaluate yourself, your thinking. A lot of us think that, oh, this won't happen to us, or this can happen to anyone. And, I see myself in a lot of these stories because, tomorrow's not promised, and any day you can wake up and something unexpected can happen. So moving right along, we're going to go to a commercial break. And then after the commercial break, we're going to have another empowering story from one of our BGH members that I'm really looking forward to her sharing. And that is with Miss Marsha Banks Harold, who's going to actually be leading our yoga, but she has a powerful story to share about her surviving breast cancer. So you're going to listen to her right after the break. So stay with us.
Feel like yourself again, the mother, the lover, the friend. Feel like yourself again, not tired and exhausted and at your wit's end. Feel like yourself again, having fun, loving yourself and others. Feel like yourself again. It's time to heal and live. If you or someone you know is struggling with their mental well-being, book an appointment today at the BGH Clinic for Women's Health, a safe space for women of color to take control of their mental well-being and feel like themselves again.
All right, so we're back. We're back with Miss Marsha Banks Harold. Thank you so much for joining us today, Marsha.
Thank you, Portia. I'm so glad to be here.
Absolutely. As I mentioned, Marsha has been with us for several years. She's a BGH member, so she's been a part of the Black Girl Health family, and has been doing yoga for us on several occasions and workshops. But it is fitting to have her at this workshop because Marsha is a survivor herself, and she has just gone through treatment. Marsha, I know you, I'm sure, like many women, have been through a lot. Can you share with us how you're doing now and a little bit about your journey?
Yes, thank you so much. Yes, I was diagnosed in May of 2023, so just a couple months ago. I am still dealing with brain fog and also just fatigue. My energy level is not as great as it used to be. However, I'm so fortunate for organizations like yours, Portia, Black Girl Health, where I feel supported. And because of that, I want to give back to others. I had my first mammogram in April of 2023. I thought it was just a standard mammogram. My mom is a breast cancer survivor of 25 years. I've had several mammograms and never have I been impacted. But in April, I went for my mammogram and the doctors called right away before I even got out of the parking lot. And they said, we need to do another mammogram for you. And still I'm thinking, this is okay. I'll get through this. It's not going to be anything that will impact my health. And what happened is they said those words to me, you have cancer. And it stopped me in my tracks because I am an executive engineer leader, a mother of 4 children. I own multiple businesses. And so I did not know how to move forward. I ended up having a lumpectomy on the left side. They also found a mass in my right side as well. I've gone through 16 sessions of radiation. And I am just so grateful to have the support of my family and my community, because hearing the words that you have cancer has really provided what I call an interrupted opportunity to reassess my life. And so since my diagnosis, I haven't been working. As an engineer, I really have been focusing going inward and using the practices of yoga therapy, acupuncture, Reiki to really kind of empower myself. I got to speak in September for the Society for Integrative Oncology. That's what I'm doing, speaking, giving back, empowering my sisters and other women that may have an unexpected diagnosis like I did. So I'm really taking it one day at a time, Portia. It's really been life changing, but having the support of my community and my family has allowed me to just stand up and be as powerful as I am every day of my life. I am a survivor.
Oh my gosh, Marcia, when you went for your mammogram, your routine mammogram, this just in April, did you have any inkling, like, did you have any symptoms or anything that you may have, you know, overlooked that you now look back at and say, hmm.
Yes, that's a great question. For me, my mass was so small that there really weren't symptoms. My doctor was not able to feel a mass on my breast. I can tell you that I've read that sometimes you may feel like a little bit of pain. But I was doing a lot of push-ups, during the pandemic. I was like trying to get stronger. So, in hindsight, maybe that was a little bit of an indication. So I'm grateful for my yoga community because they said, go get your mammogram. And when I did that, I was so shocked that there was a mass so small that was not detectable by hand. So I'm grateful for the technology that was able to zoom in and determine that there was this little mass, which I've called faith. I named my mass faith. Do this. My faith is important. So Faith and I have been going through this journey. A little bit of the faith was removed when they took out the little lump, but it left a lot of faith in my life. It's allowed me to do things like this, to be able to speak and give back. And also I started offering a sound healing class because sound healing has been so good for me in terms of the radiation, in terms of just going through surgery. I had a couple hiccups. I had to have a second surgery just a couple days after my first surgery. So I've been really pressing through this experience. But because of my faith and my yoga, I can lift my arms, I can open my heart and serve others. So I really am so grateful to be here today because this is personal for me. My
Hmm.
mother's a survivor of 25 years of breast cancer. My dad, 10 years of prostate cancer. So
Wow.
being able to be an advocate for others while healing myself is really critical.
Oh my gosh, you come from a strong family. Ah, that is such amazing to hear those, stories of, your mom is, a survivor as well. Um, so now you said that you mentioned that you had your last treatment, right? Um, how, like, you're feeling, how do you feel? How does your body feel? Do you?
Yes. Well, my body, because when I had surgery, and two surgeries at that, physically, I'm returning back to the body that I had before. There's tightness in my body, but because of yoga, I've been able to increase my flexibility. My breasts feel better. I've been using these nice creams that sisters from the community have been sending me to really kind of make my body feel good, and being a part of support groups for women of color who are going through breast cancer has been an integral part of my journey. And that's why I wanted to start my own sound healing event that I offer once a month. So physically, I'm still working through some things, but on my yoga mat, no one would even know that I'm going through this journey.
Well, thank you, Marcia, for sharing this story, and I hope, and two, as you mentioned, for those who are struggling, you do offer yoga. That could be a getaway. That is a way of healing, and you mentioned that time and time again that was part of your healing journey, and that can definitely be a part of someone else's healing journey. So, as you share some yoga with our community, definitely please share with others where they can get more information about how they can get some yoga techniques from you, and as they go on their journey of trying to heal as well. So I think that's empowering, from someone who has been through it themselves.
Thank you so much. I definitely will. And thank you for allowing me to be here to offer a little yoga, a little relaxation, meditation. These are all tools that I utilize for myself. And it's such an honor to be able to share this with you today.
Well, I'll step away and I'll let you take the floor, Marcia. It's time for some yoga.
Thank you so much. Well, thank you all for joining me today for just a little bit of what I call My Body Don't Bend That Way yoga therapy for cancer survivors and those that support us as well. If you would like, I invite you to sit in a chair or maybe sit on the floor. Even if you want to lay down, you're welcome to do that. What I've learned through this journey is being able to go inward to slow the thoughts down. So if you'll join me by possibly closing your eyes, just allowing your mind to be present with this time set aside just for you. I invite you to breathe in with me and to breathe out. One more, please. Breathe in and breathe out. And then just sit for a moment and notice how awesome you are. Notice that as a survivor, that you are awesome beyond measure. And if you've chosen to close your eyes, I invite you to flutter them open and maybe consider stretching through the neck area. Breathing in with me. Slowly exhale, lowering the right ear to the right shoulder, and just notice the stretch in the left side of the neck, and maybe even use your left hand to just notice the left side, releasing any tension that may be present. And then maybe returning your left hand to your left knee. Inhale, bringing your head back through the center. Exhale, left ear to left shoulder. I don't know about you, but through this journey, I feel like tightness through my physical body. So this practice of just moving slowly, being present. And then maybe return your right hand to your right knee, inhaling your head back through the center, and then maybe create circles with your head. Take your time, let go of any energy that's no longer serving you, making your way back through the center, and then change direction. Allow the head to move around. Beautiful. And then make your way back through the center. Exhale, lowering your chin down towards your chest. Inhale, take your gaze up towards the sky. Exhale, chin down towards your chest. Inhale, gaze up towards the sky. Inhale back through neutral. And just notice how that's feeling for you today. Maybe breathe in again and breathe out. One more, breathe in and breathe out. And now we'll add a twist. I invite you to plant your right hand onto your left knee, reaching your left hand behind you, and maybe look over towards the left shoulder, noticing the twist in the right side of your body. And when you're ready, inhale back around towards the front. I invite you to plant your left hand on your right knee, your right hand behind you, and look over the right shoulder. Beautiful. Inhale, come back around towards the front. And now let's lift our arms together as far as your body will permit. On the next inhale, float your arms up towards the sky. Beautiful. That's it. Go ahead and plant your right hand near your right hip and extend your left arm over your head, reaching towards the right side of the room. Notice how your body's responding to this. Letting go of all the experiences that you may have experienced through this journey called breast cancer. Inhale, float the right arm up, plant the left palm, and reach the right arm overhead. Sitting in your awesomeness, knowing that you are more powerful than you ever have experienced before. Inhale, float the left arm up, plant the right palm, and reach a little further, planting your right forearm onto the mat and then reaching your left arm overhead. Beautiful. Inhale, float the right arm up, plant the left palm, lower to the left forearm, and reach the right arm overhead. That's awesome. And now I invite you to lower your right hand down and let's stretch our legs a bit. You know, when we go through radiation, having to get up and down on that table, it's really nice to have our legs as flexible as possible. So I invite you to extend your legs out into a V. On the next inhale, float your arms up and overhead and then turn towards the left. Exhale, fold over the left leg and just notice your heart. As we know, this diagnosis impacts our physical, intellectual, emotional, and spiritual beings. Inhale, lift the upper body. Exhale, turn towards the right, and exhale, fold over the right leg. I'm smiling because a couple weeks ago I couldn't touch my toes, but you keep showing up for yourself and it'll all work out. Inhale, lift the upper body, palms face forward. Exhale, fold through the center, allowing your heart to lower down towards the earth, recognizing your strength, your resilience, and your power. On the next inhale, lift the upper body. Exhale, float your arms down. That's beautiful. Let's bring the soles of our feet together for a bound angle pose, holding onto your toes or your ankles, breathing in with me, and slowly exhale, full forward, allowing your nose to come down towards your toes, feeling the stretch in your hips, the groin area. Beautiful. On the next inhale, lift the upper body, and we'll do this together again. Breathe in with me. Slowly exhale, full forward, allowing your nose to come down just maybe a little closer to your toes. And rest. Be present. On the next inhale, lifting the upper body. That's awesome. Let's extend our right leg towards the right. The sole of the left foot comes to the inside of the right leg. Your right toes dorsiflex towards your hip. Inhale, float your arms up. Turn towards the right and exhale, fold over the right leg. giving yourself some grace throughout this journey. On the next inhale, lift the upper body. Exhale, float your arms down. Beautiful. And now we'll extend the left leg towards the left. The sole of the right foot comes to the inside of the left leg. You're doing great. Inhale, float your arms up and overhead. Turn towards the left. Exhale, fold over the left leg. Maybe 3 more breaths here. On the next inhale, lift the upper body. Stretch your arms up. Beautiful. Exhale. Float your arms down. And now we'll transition to double pigeon. So I invite you to bring your left ankle on top of your right leg. Your left knee is going to stop on top of your right foot. Inhale, float your arms up. Palms face forward. Exhale, fold through the center. Maybe 2 more breaths here. On the next inhale, lift the upper body. Exhale, float the arms down. And now we'll go to our final side. So gently release the left leg and bring the right leg on top of the left, stacking the right knee on top of the left foot. Inhale, float your arms up, palms face forward. Exhale, fold through the center. Be mindful where you are today, practicing being in the present moment. On the next inhale, lift the upper body. Exhale, float your arms down. And then go ahead and release your right leg down. And then maybe meet me on hands and knees. So swing your legs around towards the side. I'll turn sideways so you can see my form. I invite you to spread your fingers wide, middle fingers reaching towards the top edge of your mat, stacking your shoulders over your wrists, your hips stacked over your knees. On the inhale, lower your core down towards the earth as you take your gaze upward, tailbone reaching towards the sky. Exhale, round the spine, gaze towards the core. Beautiful. One more. Inhale, gaze goes up, core reaches down, tailbone reaching up. Exhale, round the spine, gaze towards the core. Inhale, back through neutral. And we'll stretch our calves out a little bit today. I invite you to extend your left foot back, resting on the ball of the left foot, and pressing your left heel down towards the mat, releasing any tightness that may be present. And then return the left knee back, and we'll try the other side, creating balance in our life, pressing the ball of the right foot onto the mat, pressing your right heel down towards the mat. And then return the right knee beside the left. And let's explore child's pose. Allow your knees to come to the outside edge of your mat. Your big toes come together, reaching your arms out in front, lowering your forehead down towards the mat. And surrender. Let go of any worries or concerns. Tap into your resiliency. Maybe 3 more breaths here. And then go ahead and walk your hands back underneath your shoulders. Bring your knees underneath your hips. Press the balls of your feet into the mat. And on the exhale, lift your hips up into the air, into downward facing dog. And just notice how strong you are here throughout each part of your journey. And then take your gaze forward. Bend your knees, walk or jump to the center of your mat. Inhale, halfway lift. Exhale, reach back down towards the earth. Inhale, reverse swan dive up, arms up and overhead, palms together. Exhale, down. And then let's just do a little bit of balance work together, because we all know as survivors that this journey has you feeling as if you can't balance yourself again. But I am a testimony that you can find it again. Plant through your right foot. Let your left heel come to the inside of your right leg. I invite you to bring your palms together, heart center. And this is the full expression. If you want to try a little bit more, I invite you to reach your arms up and overhead, and then maybe slide that left foot up the right leg, finding our tree pose. finding our strength and courage to continue to be resilient and to continue on this journey. Releasing, palms together, exhale down through heart center. Release your arms by your side, and we'll do the opposite side. So plant through the left foot. Let your right heel come to the inside. Maybe bring your palms together at heart center. Maybe slide that right foot up. Beautiful. Maybe extend the arms up and overhead. Being grateful for this opportunity to thrive, to survive, to be powerful beyond measure. Bringing your palms together, exhale down through heart center. Release the right foot by the left, arms by your side. Beautiful. And now meet me at the top of your mat. Step your right foot forward and then extend the left foot back. These are the postures I did right after I rang that bell on radiation day. Warrior two is this one. Bend your right knee. Reach your right arm out in front, your left arm behind you. Look over that right middle finger because we are warriors. Maybe sink a little deeper. And now I invite you to turn your right palm up, float your right fingers up towards the sky as you reach your left hand down the back leg. This is our reverse warrior. Sometimes we get a little setback in our life, but being survivors, we're able to move forward together. So I invite you to plant your right forearm onto your right quadricep and extend your left arm overhead. Extended side angle. And just notice your strength, your power. Beautiful. Inhale back through warrior two. Straighten that front leg. Shift your left hip back. Reach forward with the right hand. Exhale, lower your right hand down as you reach your left arm up towards the sky. Triangle pose. And finally, inhale, lift back up. Exhale, lower your hands down, and we'll pivot together, allowing your left toes to face the back edge of your mat. Inhale, lift your arms into a T. Bend the left knee, warrior on this side. Sometimes you have to shift your direction, but you still have the support of your family and community. I invite you to float your left fingers up towards the sky. Reach your right hand down your back leg. I also call this my selfie pose. Looking at my hand, knowing that I have all the knowledge, power, and wisdom to continue to survive. And then I invite you to plant your left forearm onto your left quadricep, reaching your right arm overhead, and breathe. Inhale back through warrior two. Straighten your front leg. Shift your right hip back. Reach forward with the left hand and exhale. Lower the left hand down as you float the right arm up towards the sky. And just know that you are strong, that you are powerful, that you are resilient. Inhale, lift back up. Beautiful. Pivot your feet towards the long edge of your mat. Your palms face forward. Maybe lift one heel and the other and sink down into goddess pose. Yes, we are all goddesses. We have all that we need. Maybe pulse up and down with me. Notice your strength. Notice your resiliency. Notice your compassion for yourself, for your community. And then find stillness and hold with me. Just a couple more breaths. That's it. That's beautiful. Go ahead and straighten your legs, lower your knees, straighten your arms out into a T, and then go ahead and fold forward, planting your hands onto the mat, allowing the top of your head to come down towards the floor. Maybe you separate your legs a little wider and just surrender. Notice the strength that you feel through the bottom of your feet. Maybe 4 more breaths here. And then maybe straightening your arms, keeping your right palm planted. I invite you to lift your left arm up And maybe look at the left thumb. And then lower the left palm down. And we'll go to the opposite side. Inhale, reach the right arm up. And then lower the right hand down. I invite you to heel toe your feet in underneath your hips. Return to that goddess pose. Lifting your heels. It might be a little shaky. Meet me here pose for the last 5, 4, 3, 2, 1. Straighten your legs, lower your heels, extend your arms into a T, lower your arms down. And now I invite you to meet me back on the floor. We'll do a little bit of a body scan. I found this practice to really be useful in my healing journey. So you decide. You can meet me by coming to the top edge of your mat first. Inhaling, float your arms up and overhead. Exhale, swan dive down. Beautiful. Inhale, halfway lift. Exhale, plant your hands, step or jump back to your high plank. You can lower down to your knees, planting the top of your feet onto the mat. Exhale, lower down. Maybe slide your hands down. Inhale, lift up to upward facing dog, and then just push back to child's pose. Holding here for 5, 4, 3, 2, 1. Slowly come on up. Meet me back in table. Well, just meet me in a seated position. We'll meditate together for a couple moments. You find a position that's best for you. You can lay on your back. You can stay seated. Let's check our bodies out. Notice your toes. Some of my sisters have told me that they feel some type of instability in their feet. So after radiation or chemo, so just notice your toes. Send them love and healing. Notice the bottom of your feet. Notice the top of your feet, your ankles, your shins, and your calves. Send love to your toes, the bottom of your feet, the top of your feet, your shins, and your calves. And now notice your knees, your hamstrings, and your quadriceps. Notice your hips. Notice the release of anything that no longer serves you. Notice your core, your chest, your shoulders. Being in the present moment, being mindful of who we are and where we are in our lives. Notice your elbows, your wrists, each one of your fingers. Notice your upper back, middle back, and lower back. Notice your neck, your chin, and your cheeks. Notice your forehead and the very top of your head. And whether you're seated or lying down, I invite you to join me in this final mudra, bringing your pinky fingers together, your thumbs, and allowing your fingers to open up to the side. This is a mudra that I really love. Maybe close your eyes and embrace this lotus flower mudra. The lotus flower looks beautiful on the outside as it floats on really muddy water. But that's where it blossoms. So I invite you today to know that even though it may seem that this breast cancer is not as easy as you thought it would be, that you have all the knowledge, power, and wisdom to be strong, to be resilient, to seek help when you don't feel like you have the energy to give. It truly has been my pleasure to serve you, and I send you healing, comforting, compassionate energy. Until we meet again, go in peace. Ashe. I want to invite you all to connect with me at piesfitnessyoga.com. P is in Paul, I is in ice cream, E is in Everett, S is in Sam, fitness, FITNESS, Pies Fitness Yoga. This is the brain fog piece I'm telling you about. Piesfitnessyoga.com. It's very real. Hey, but you know what yoga has done for me? It's allowed me to go with the flow, even when the brain does not come when you always want it. So thank you all so much. This is my website, Pies Fitness Yoga. You've seen in real time what cancer does. It allows you to forget stuff that you've been saying for 13 years. Thank you, Portia.
Thank you so much, Marcia. Thank you again for joining us. And take care of yourself. We'll be praying for you. And again, thank you for being a part of our sisterhood and spending some time showing us some yoga today.
Thank you so much. Have a great one.
All right. Okay, well, I hope everyone is enjoying what they're seeing so far. I would like to let people know about Black Girl Health a little bit. We have a outpatient mental health clinic. We know as a breast cancer survivor or being diagnosed with breast cancer, there's a connection with mental health. It can be very draining. It can be very mentally taxing. And so we have an outpatient mental health clinic to definitely cater and accommodate and serve anyone who is struggling through any chronic conditions. So please definitely check us out at thebghclinic.com. Again, it's thebghclinic.com. All right, so we're going to go to break and then we'll be back with another workshop. So stay with us.
Feel like yourself again, the mother, the lover, the friend. Feel like yourself again, not tired and exhausted and at your wit's end. Feel like yourself again, having fun, loving yourself and others. Feel like yourself again. It's time to heal and live. If you or someone you know is struggling with their mental well-being, book an appointment today at the BGH Clinic for Women's Health, a safe space for women of color to take control of their mental well-being and feel like themselves again.
Hello, I'm Portia Grigsby. We are back. We are back with another testimony. So before we go into our workshop, I would like to share another story from a survivor, and that is Miss Jasmine Sowers.
Bowers, and I'm a 6-year breast cancer survivor. I was diagnosed with breast cancer at 26 back in 2016. I was about 2 years into my marriage at that time, and my first signs that something was wrong was actually that my breast was really painful. I noticed discharge in my bra, but I didn't recognize it as discharge. I was very top heavy. I was triple D's, and so I thought that maybe food was falling in my shirt, and it was not. There was a day where I was standing in front of the mirror in a ribbed tank top, and the lines helped me see that one breast was absolutely swollen. I learned how to do a self-exam a few months prior at an event at work, and so I started to work my hands around my breast. I noticed that there were some texture changes physically, so some parts of my breast were a lot harder than others. And then as I reached around to the bottom of my breast, discharge expelled, and then I became very concerned. At this time, I was 25. And it took me about 6 or 7 months, 2 past mammograms, past ultrasound, dismissed at the doctor's, dismissed at the hospital before I got to a doctor and I said, hey, I think something is wrong. And even though she could not replicate the discharge, the difference was that she said, if you think something's wrong, something is wrong. From there, I connected to a breast surgeon where the second mammogram took place. And once we realized that something was still wrong, we did a breast MRI. After a biopsy, we got the results on December 30th, 2016. And I remember saying to myself that that next year was gonna be like really wild. And it absolutely was. After that, I did a bilateral mastectomy, 25 sessions of proton therapy radiation, and I completed 5 years of hormone therapy last year in 2022. From the very beginning, I was determined to not let this just be a horrible thing that happened to me. I needed to have purpose. I did not want to just have this horrible thing that disrupted my life. And like, I lost so much. I felt like in the middle of all of this, I just did not want it to be in vain. And so I very quickly turned outward. I was maybe a couple weeks out from my mastectomy before I started making notes of all the things I felt like people dropped the ball on me, whether it was not having a place where I could try wigs on because I was inconclusive from chemo for a few weeks, or it was being dismissed, or not having people that looked like me in the support group. And immediately I started to say, how can I do something with this? That is actually one of the things I wish I would have done differently, being on the other side of it now, because I realized that I never really gave myself time to be a patient. I never really gave myself time to get the support. I turned very quickly to helping others, which can be a good thing, but I think there's also a space needed for us to take care of ourselves in the middle of the madness. I started volunteering with Young Survival Coalition, leading a support group for young women in Jacksonville, Florida. Then I went on to co-found For the Breast of Us, the first online community for women of color affected by breast cancer. And today I am leading the Missing Pink Breast Cancer Alliance, which is an organization dedicated to advancing health equity through collaboration and community. And this month we are launching More Life Magazine, which is a resource for people of color affected by breast cancer. And it's really dope because it has different stories from people all across the breast cancer community, including men in the LGBTQ community, and it's connecting those experiences to resources. So it includes a resource directory of over 300 things, from advocacy to breast cancer surgery to health and intimacy, all those things. If you are navigating your breast cancer journey right now, I want to encourage you and speak life into you and let you know that it is well. There is new life on the other side of this. It does not have to look the same for it to be good or even better. Your journey is your journey. It won't look like what's happening to everyone else. It doesn't have to look like what's happening with everyone else. Give yourself freedom to decide what life looks like from this point forward. And if you are on the fence about whether or not you should get checked out, this is something I really, really, really want to speak to the hearts of women right now. One of the things that we're seeing with Black women in particular is this voluntary delay of diagnosis. It is hard enough for us to be seen and recognized by doctors. It is even worse if we won't recognize our own pain and our own suffering. When you have the ability to get symptoms checked, and you avoid getting the symptoms checked, you are not delaying being sick. You are just delaying getting treatment. Delaying your treatment is the equivalent of taking the hourglass and just shaking the sand out. But when you take the steps to get your symptoms checked out and to get the treatment and support that you deserve, you turn the hourglass upside down, and you continue to do that every time you choose to take care of yourself. That's more time with your family, with your friends, more time to follow your dreams. There's something that you are meant to do on this earth, and I want you to do it. But in order to do that, you gotta take care of you, boo. Take care of you.
like yourself again. The mother, the lover, the friend. Feel like yourself again. Not tired and exhausted and at your wit's end. Feel like yourself again. Having fun, loving yourself and others. Feel like yourself again. It's time to heal and live. If you or someone you know is struggling with their mental well-being, book an appointment today at the BGH Clinic for Women's Health, a safe space for women of color to take control of their mental well-being and feel like themselves again.
How y'all feeling out there? Have y'all been enjoying yourselves yet? Where's my DMV people? Where's my Be More people? Any Be More? I know we had a few people from New York. Is there any New York people? And then I saw some people from Virginia, like Virginia Beach, like down. Yes. Well, I'm so glad that you ladies are here. This is BGH Live, a live streaming talk show aimed to transform everyday minority women into well-informed, healthier individuals. And we're going to talk about fibroids. Any of you ladies have them? Been dealing with them? Know someone who has fibroids? Anyone? All right. So fibroids are benign tumors that we know, right? And 80% of Black women have them. And it's really some serious ish. And doctors, conventional doctors, a lot of times, they don't talk about how serious fibroids are. So I have Dr. Jaleesa Hernandez in the house with us today. And she's going to talk about how to shrink your fibroids naturally without surgery. I want everyone to please give a warm welcome for Dr. Jaleesa Hernandez.
Hello, Portia.
I'm so glad you're here, Jaleesa. So glad you're here. So I know we had 3 foods on the table here. We have kale, we have kelp, and we have broccoli. And I know that these are foods that really can help shrink your fibroids. Can you talk to me first about the kale?
Absolutely. So one of the causes of uterine fibroids is having toxins, toxic bodies. And so kale helps filter excess toxins in the body.
Filters, really?
Yes.
Nice. Is it now, how much kale do you have to eat? Like, do I have to eat kale all day?
I recommend whenever you're eating portions, take your right hand, kind of hold it as if you were holding, kind of like the size of, not too much of a closed fist, but a nice normal cupful, handful. That would be the amount, at least 2 to 3 times a week.
2 to 3 times a week. Okay. Now, kelp.
Yes.
Hey, I'm going to be honest with you, ladies. I didn't know what kelp was at all.
Sea veggies.
But yes, explain to me, how does kelp help to shrink fibroids?
Okay. So one of the causes of uterine fibroids, low thyroid. Raise your hand if you know someone that has a low underactive thyroid. Kelp, natural iodine, helps the thyroid, helps to shrink fibroids.
Okay. And broccoli, I don't have a problem with this. I probably eat broccoli like all the time, but talk to me about it.
My favorite. The liver needs help. The liver
Yeah.
is overloaded. If you have estrogen dominance, that is one of the causes of uterine fibroids. And broccoli is the #1 vegetable that helps to balance hormones and helps to filter excess estrogen.
Really?
Yes, it helps to dissolve uterine fibroids.
Oh my-
Organic, of course. Everything should be
Oh,
organic.
organic. And why organic? Because I know sometimes you're probably like, okay, I'm getting broccoli, I'm eating my greens, and it's not organic, but they think that's okay though.
A wonderful question.
Okay.
Mind you, if you're not eating organic, you're intaking genetically modified organisms, pesticides. We need kale to filter toxins. Part of one of the reasons of developing uterine fibroids, a toxic body.
Oh my gosh. Well, I hope you ladies learned something because I just learned something in these few minutes. Tell us about this book. Now, if we wanted to know more about how to reduce fibroids naturally, your book says it all.
Yes.
So
thank
talk
you.
to me about it real quick.
Thank
Where can
you.
we find it?
So I, as of today, still have a 100% success rate helping women and couples conceive babies. And so I was asked to write the book because of that. And so in my book, I discuss fertility, uterine fibroids, increasing sex drive, making the female and male reproductive system healthy. And you can find it on Amazon and Audible in English and Spanish.
Oh, nice. The naturopathic approach to
fertility.
fertility.
Naturopathic
Yes,
approach to
yes.
fertility.
And I think, are you even selling this today?
Yes,
Yes, yes.
I'm at the vendor table.
Yeah, vendor table.
And I'm
Yes.
in my workshop as well, and I'll
Perfect.
be giving away 3 books in my workshop.
3 books.
For
Okay.
those that are listening and answering the questions correctly.
Love it, love it, love it. Well, thank you so much, Dr. Jaleesa. After the
Thank you for
commercial
your
break,
patience. Laryngitis. Thank you.
after the commercial break, we will have the actors.
This is a metabolism killer. This is a metabolism killer. And even this is a metabolism killer. The sad reality is most people eat these foods every single day and wonder why they can't lose weight.
Quick change. All right. So we all know that exercise is very important, especially if you're trying to lose that stomach, right? We were just talking about the fibroids. Right. Okay. So for that reason alone, you want to do exercises that actually flatten your stomach. So Ellen and Alana from Atlanta, ATL, they're here back with us to BGH Live, and they are going to demonstrate some stomach exercises that can help us flatten our stomach. Please give a warm welcome for Ellen and Lana Ector! Hey, 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 hey. Okay, mama. All right. Oh, we going. Okay. Hey. All right. All right, ladies. I know you're going to help. You're going to demonstrate some different exercises to help us lose that belly fat. But I want two audience members, if we have them, to come up and join us. Do some exercises. Give me. Oh gosh. Let's pick one right there, and I'll pick that one. That one just stood up. So I'll just come here. Come here. Come here. So we got one. Oh, we got more.
Oh, we got multiple.
Okay.
Okay.
You know what? Let's
improvise.
Let's all just come together. Let's all,
Okay.
there you go. There you go. We got more the merrier. There we go. Picker. Yep.
Got your mat?
Don't worry. We'll just all work together. Ellen,
Okay.
I'll let y'all take it for us.
Okay.
Tell us what we do.
Well, first, I don't do none of my ad workouts without my waist sculptor. And
Oh,
I know I got you one, girl. Don't worry.
Okay.
I got all of y'all one. Okay. So, of course, a lot of ladies after having kids, we struggle with that lower, stubborn body fat. So, this is my Fupa control. So, we're going to get into our ad workout. You're gonna get on the mat. And you can do this with a partner or no partner.
Okay.
And we're just coming back on that lower ab. So we're just doing like an elevator. Yep, try to get off of your hip.
Up like this.
Yeah, perfect. Kick back. And if you do have a partner, you challenge your partner by kicking her legs down, but not letting her feet hit the floor.
Oh.
And for my modified ladies, I'm not leaving y'all out. You can stand right in place and come up and crunch.
Alana,
okay?
how long? How many do we got?
Give me 5 more. Give me 5 more seconds.
Okay.
5, 4, 3, 2. There you go. 1. Good job.
Nice.
Good job.
Yes. Good job, ladies. Good job. Feeling it? Okay. The next exercise. What we
Okay, guys, one of my favorite exercises, because I want to keep it tight.
Keep it tight.
I'm 67, but who say 67 can't be sexy? I love the plank. Plank, yeah. We're going to hold our fist up. Get on them elbows in your forearm. Legs straight back. Oh. And look straight ahead. Yeah. Tighten up that booty.
Oh, yes.
Let's stay here. 3 seconds. 1, 2, 3. Drop. Uh-oh. Woo. Now I have a variation. I want you to kick out. Go to the music. Let's go. Come on.
Oh.
Hey.
Oh. Oh my goodness.
On them knees. Uh-oh. Let's stand up.
Stand up. Okay.
Trying to give us a standing ab.
Okay, standing out. We can kick out.
Kick out.
There you go. Just take, yeah, there you go. Just squeeze it in. Our whole objective when you work your abs, you want to make sure you feel a nice little squeeze.
And what I love about this, I mean, you don't have to be in the gym. And,
right.
You know, you can do this before
Right
you go to bed in the morning. Right?
So true. Woo. But most importantly, guys, your abs are made in the kitchen.
That's true.
Oh, you have to watch what you eat.
You got to.
Can't be putting in no Mickey D's and think you're going to have a flat tummy.
All right. Well, everyone, give it up for Alana and Ellen.
And you guys.
And give it up for our volunteers as well.
Yeah.
For Ellen and Thank you, ladies. Thank you. Woo. And I'm already out of breath. I don't think I can even toss to the next segment. Right? All right. Well, when we come back after commercial break, we're going to have with us Courtney Daniel. All right? So stay with us. Woo! Woo! Oh, got it.
Hi. Hey, how you doing? Javon.
Oh, Jenna, nice to meet you.
You look great.
So listen, I know it's our first date, but before we got started, I just wanted to ask you a couple of questions to get this thing kicked off.
Yeah, you can ask me anything.
Just a couple.
Do you have kids? More than 2? If you got a baby mama, is she trying to kill you? Do you take showers before you go to bed? Or do you jump in that bed dirty instead? Do you like God or do you love the devil? Before we take it to another level, do you like women or do you like men? No judgment, just don't want surprises again. Before we get too invested, is your apartment roach infested?
Don't forget, girl, ask him if he ever been arrested.
Oh yeah, and when's the last time you've been tested?
Pop the question. It's easier than you think. For your health and your partner's health, let Black Girl Health help you get it done. Visit our website and get tested today.
All right, well, ladies, I don't know about you, but I love every kink in my hair when I'm wearing it. But it wasn't always this way, and it definitely wasn't easy going, with the big chop and everything. And I think a lot of you ladies can relate to that when you're trying to go natural, right? Right. And sometimes there's a lot of confusion about the products you should use when you're going natural. So I invited someone by the name of Courtney Daniel, known for Curls and Couture. She is the face and creator behind the organization, and she's going to give us some help on the tools and the products we should use when we're trying to go natural. So please give a warm welcome to Courtney Daniel.
Hi, everyone.
Hi.
Thank you.
Now, Courtney, your hair looks amazing.
Thank you.
Love it,
Yours
love
is
it,
too.
love it. So we all, having trouble. It's a scary process for us.
It
When we're
is.
about to,
Mhm.
take away the chemicals and chop off all our hair, and we don't know how to kind of get that. We're going natural, but we want to look good
Yes,
going natural.
yeah.
So talk to me about these products on the table.
So every product in here is really dedicated to making sure your hair is moisturized. That is the key. When you're transitioning, you have two different textures. You have your natural texture, and then you have your relaxed texture. And that point where that hair meets is so sensitive and so delicate. You can easily snap your hair like that. So you want to make sure that you're infusing a lot of moisture to keep your hair.
There's a hidden cause of joint stiffness that won't show up on an x-ray. And you probably never
Just as moisturized as possible. Just getting these two in, making sure your hair is clean. I didn't bring a shampoo, but making your hair needs to be clean, and then you put the moisture, and then you style.
Now, does it matter? Because I know sometimes we're trying to get that, like, our natural curl.
Yeah.
Is like just keeping your hair moisturized with products like this. Will the natural curl just come out? Like, how does that really work?
Yeah, so your hair, what they call is scabbing. So when your hair is growing out of that relaxed state, sometimes it's funky. It just doesn't feel right. It doesn't look right. Your hair has to not be weighed down from the relaxed texture, because that's what it does. It weighs down your curl, so you don't really get to see your true curl. But this is going to help train your hair. Okay, like, we're putting in good ingredients. We're putting in lots of moisture, because I don't know about you, but when my hair was relaxed, I wasn't doing anything but getting a relaxer and putting it in, wrapping it, or putting it in a scarf.
Absolutely.
I wasn't doing
That's
anything.
pretty
So
much.
introducing this product, your hair is going to realize, okay, now the scabbing has to come off. My hair is going to be soft. My natural curls are going to come through.
Love it.
Yeah.
Love
So it's a process. It's a journey.
Love it. Love
Yeah.
it. Well, please, y'all, Courtney Daniel. Amazing.
Thank you.
I want to get hair like this, right? Amazing hair. Okay, after the commercial break, girls, we got Stefan Lavoisier in the house with us, and he's going to talk about healthy relationships. So we'll be right back. Stay with us. Awesome.
Don't know if you got a girl. Don't mean no disrespect, but thoughts of you rule my world. I even dream of you, I swear. Visions of you and I. See you all around my way. Been meaning to say hi, but I'm just way too shy. I gotta make you see this is more than just a silly crush. And I wonder if you even know it's me. You gotta feel me.
Hello, everyone. I hope you guys enjoyed that show. Well, we are back with I'm a Survivor. And up next is Dr. Tanya Mosley with MD Anderson Cancer Center. Is going to be talking about breaking down barriers, what all women should know about breast cancer. And so I am happy to introduce Dr. Tanya Mosley. Hello, how are you doing today?
I am well. How's everybody? I need one of those t-shirts. What's going on?
Oh, we got to send you one. Thank you so much.
Otherwise, I would have totally represented with the t-shirt. I do have on the pink, but
so we're coordinating. That's good. We're coordinating.
We're coordinated, but yeah, I would have totally worn a t-shirt to totally represent. So I am so excited to be here. So clap to everybody who's watching online, and just happy to be here. Jeanette Lestrade is going to help me with my slides. So let's see. She's going, oh, there she is. Jeanette is going to help us. So this is wonderful. So I'm Dr. Tanya Mosley. I am a professor of breast imaging and breast surgical oncology at MD Anderson Cancer Center in Houston, Texas. If you're outside of the States, it's in the USA. So we are going to show you some slides about what Black women need to know as far as breast cancer is concerned. So just as soon as Jeanette gets those slides up, we will be ready to go. Oh, perfect. So let's just start out at the beginning. Black women die more often than other, and race is a historical term. We're all part of the human race, if you will. So we as Black women die more often than do other women. So somehow the slide popped off, but I'm sure it'll pop back on for you to see. But we'll just keep it going. So when they pop back on, we'll just start back up with it. So for us, we die more often than do other, what I call ethnicities, because I like to think of all of us as the human race, if you will. So we as Black women die more often. But you know what? It doesn't have to be. And that's why you're here today. That's why you're here today, is you're here to find out, what do I need to do? What do I need to do? And if you're a guy tuning in, you're like, how can I help my loved ones? And now black men or men in general, they can get cancer as well, but it's much less often than do women. I see the slide here. So the question is, well, what is cancer, Dr. Mosley? What's cancer? What is this? Well, if you look at the slides and you see those blue slides there, well, those are abnormal cells. And cancer, abnormal cells, is when the normal healthy cell divides without order and control. Next slide, please. And thank you, Jeanette. So there are types of breast cancer. So the two big types are ductal and lobular carcinoma. Also, Black women need to be mindful of triple negative breast cancer, which is a type, and also inflammatory breast cancer, which is another type. So next slide, please. So we get cancer at the same rate as other women. So it's not like we're getting cancer at, a higher rate. The problem is the death rate. Our death rate is about 40% higher than it is for other women. So next slide, please. So why does this matter? Well, it matters to the person who's getting it, of course, and it matters to everyone who loves them. But we're twice as likely to get the aggressive type of cancer. And this is particularly important because it can happen in women who are younger than 40. So we have to be on the lookout for cancer. And that's why you're here again today. I can't say it enough. So what about risk factors? What are some of the risk factors? Well, there are some things we can't control, and these are they. So hormone and reproductive status, breast diseases and lesions. So say you had a tumor that caused you to get radiation to your chest. Well, that's going to expose your breast. And so that's a factor you can't control. Also, dense breast tissue, you're going to see that on your mammogram report. So be sure to look on your mammogram report to see the density of your breast. So there are going to be 4 types on that mammo. 1, it'll be almost fatty replaced. 2, scattered. 3, heterogeneously dense. And 4, extremely dense. So which ones are the ones that are considered dense breast tissue? It's the heterogeneously dense and the extremely dense. And then lastly, we're born into the family that we're born into, the wonderful family that we're born into. So genetics are risk factors, that are not controllable. But we can reduce our risk. So, as Black women, you just saw a commercial about exercise. I hope you exercise along with them. So maintaining a healthy weight, getting active, limiting alcohol, and choosing to breastfeed. Breastfeed is not only good for your breast, but it's also good for the baby. And then know your family history. I always like to add about family history. Sometimes we don't know our family history if we're adopted. Well, when and if you decide to start your family, then make sure everybody knows the family history. So what are things to know? Knowing if anybody in your family developed breast cancer before the age of 50, so that's early breast cancer. Knowing about your relatives that may have ovarian cancer or family members that may have breast and ovarian, or a family member who's had breast cancer in both of their breasts at the same time. That's called synchronous cancers. Any family members with triple negative breast cancer. And lastly, if you have a male breast cancer family member, if we had 100 breast cancer survivors, 1 would be a man and 99 would be women. So breast cancer in men is very rare. So that's a very important piece to know. So I'm just going to take a little break here. Just when we talk about know your breasts. So that's for you men too. For those of you who are watching, you do have breasts. So while you don't have to get a mammogram or an ultrasound or an MRI like women do, you do need to check your breast too if there's a man watching. Make sure you check your breasts when you're doing your bath. Okay, so commercial over. Now back to women, knowing your breasts. Let's take a look here. So we're looking for breast changes. So don't be afraid to stand in front of the mirror and take a look at your breast. So the circle in the top left, you see a little knot, if you will. Oh, thank you, Jeanette. That little knot is something you might feel or you might see. Then the next one in the center, that's under your underarm. So you need to check your whole breast, the whole thing, and then also under the underarm as well. The next circle over, that shows skin changes. So you need to look at your breast, look at the skin of your breast, and look for any changes. We as Black people sometimes forget to look at our skin in general, and we too should be wearing sunscreen. And again, another little tiny break here. Sometimes the sunscreen can make us look ashy, so look for sunscreens that are specific for brown skin. Okay, the next circle there. So that's dimpling, if you will. So here's my arm. I'm going to bring it close. So that's my arm normally. And so dimpling is just really pushing in the skin. So you're looking for that. The next one, that's podange, or like an orange peel. So if the breast starts to look like the peel of an orange, come on in and see us. We will take care of you. And then the next one just talks about general changes to your skin. So anything that is a change, and a change for you, come in. Next, let's talk about nipple changes. So firstly, the first one is nipple discharge. And this is discharge that happens on its own, not with squeezing of the nipple. And I ask folks to refrain from squeezing the nipple because sometimes squeezing of the nipple can cause discharge. So this is nipple discharge that happens on its own. You see it on your gown, or you see it in your bra. So that is nipple discharge that happens spontaneously. The next circle over, that is what's called nipple retraction. So this is for people who have a nipple that points out and all of a sudden the nipple is sucked in. So again, it's a change. So if your nipples are normally like this, and now all of a sudden they're sticking out, then that's a change for you. The next circle over is for people who have protuberant nipples or nipples that stick out. So if your nipple is directed in a different orientation, then that's a change. The first circle at the bottom, that's an ulceration of the nipple, and you haven't had an injury. So there's something going on there. The next one over is changes to the nipple areola area. So you know there's a dark skin around the nipple, and then the nipple's in the center of it. So if you see changes there, that's not dry skin, eczema, it's not ash, you need to come in because that's a nipple change that requires some attention. So question, true or false, there is nothing that Black women can do to reduce their risk of breast cancer. False. There is definitely something that you can do. And you know what? You're doing it by just being here. You are your best advocate. We're here for you at MD Anderson, but you are your best advocate. We'll hold your hand the entire way, but don't forget, you are your best advocate. So what can you do? Get screened. So if you're between the ages of 25 and 39, we'd like for you to consider getting a clinical breast exam every 1 to 3 years. But I always say, you know, time goes so fast. If you're able, get it every year because it's hard to remember. Am I on year 1, year 2, year 3? It's just easier. And if you start a good habit of getting it every year, look at there at that next one. When you get to age 40, we want you to get it every year anyway. So a mammogram and a clinical exam yearly at age 40 and older. Well, you say, well, I'm at increased risk. What do I do? So we have an answer for you. If you're at increased risk for developing malignancy, then you need to get tested at an earlier age, which may include an ultrasound or an MRI. There are also preventive medications that you can take, and that's a good discussion to have with your doctor. Also, you and your family members can get genetic testing. That's helpful for the generations to come. And there are some patients who are at such an increased risk that they choose to have a mastectomy. But those are conversations with your doctor. Now we know this is a journey. So we have to acknowledge and address some barriers. So what can that possibly be? Well, we want you to acknowledge any fears that you have and to discuss them with us. Look within yourself and become aware of what you might be afraid of. When you're thinking about things, use your imagination in a positive way. Try to think good thoughts as much as you can. Please, please. Talk with people that you trust, your family and your friends. And when you come and you talk to us, tell us what you're afraid of. I had a patient yesterday and she told me, she said, Dr. Mosley, I am so afraid of needles and getting a biopsy. And I told her, I said, you know what? We will take care of you. We will take care of you. And if you need us to hold your hand while you get this biopsy, we will hold your hand. So we will hold your hand. We will talk you through it, whatever it is. But what most people say is like this patient, she said, you know what? That biopsy wasn't as bad as I imagined it. She said, I imagined it to be horrible, but it wasn't. And having my hand held made it all the better. So acknowledge your fears and let us help you get through it. We have to prioritize ourselves as women Oftentimes we put everybody first and then we get what's left over. So how can you prioritize yourself and your health? Block some time for your appointments. I know people work and they have so many responsibilities, but please carve out some time for yourself. Set reminders. We all have smartphones now, so that smartphone can give you a ding, a reminder. And then when you come in and you see us, ask us what to expect. So you can have expectations about how long it's going to take, what you're going to do, what the appointment's going to entail. Speak up. Speak up. And if you can't, we all have a friend or a loved one who's ready to ride at any moment, ready to go with us and ready to speak up for us. So if you don't feel comfortable speaking up, bring that person with you. So when you come in, ask us about your risk. Ask us when your tests need to be studied, set up, not studied, scheduled. Don't be afraid to follow up with us. Now in this new age of social media and electronic records, you can send messages to your providers through electronic means. If you don't understand something, ask a question or bring that family member or friend with you to ask it for you. Not all of us are the same culturally or have the same religious beliefs. So let us know that too. We will be respectful of your cultural and religious beliefs so that we can care for you all the better. If you make a plan, it'll help you execute that plan. For us at MD Anderson and many other medical facilities, there are more than one facility. So look for facilities that are close to you or that have what we call flex times. As you can see, I'm at work today. We do have some services on Saturdays. So that works for women, who work through the week and they need to come in on the weekend. Again, we're living in an electronic age. So if you're possible, sign forms electronically if you can. Not everybody is able to do a whole lot of tests on one day, but if you are, see if you can schedule multiple exams on the same day, and then you can get things done. There are opportunities for telehealth appointments. So if that's an option and it works for your situation, consider that. And then one thing that I've seen with church groups and families, everybody goes together. So they all ride together, they support one another, and they all get their studies on the same day. Depending on where you live, there are multiple options for transportation. So look into that. Here in Houston, you can Uber, you can drive yourself, you can take the tram, you can take the bus. There are so many options for people, but look for options where you live for transportation and what works for you. Now we know there's a cost involved. We would be remiss if we didn't acknowledge that. Please, please, please try not to get overwhelmed or discouraged. There are available resources. There are groups that support women for their tests. Some of them support housing, childcare, transportation. So please look for available resources. Many institutions have what's called a patient navigator or a social worker. And so these individuals can help you find areas and places that can help you with financial support. As they help you navigate and find financial support, please keep up with your screenings and your regular visits. We're Black people, and so again, we have to acknowledge the truth of the world. There is racism in health, but it can't stop us from getting the care that we deserve. Through the years, there have been several instances of broken trust with healthcare in the African American community. But I, as a Black person, believe in healthcare. Well, obviously, I'm a doctor, so I believe in it. So what do you do? What do you do? Ask your family and your friends for places and physicians that they trust and that they've had a good experience for. If you don't feel you've been treated as you believe you should be or that you've been valued, ask for another provider. You know, at our institution, you can change providers if you don't mesh with one particular provider. And also, no matter where you go, it is your right as a patient to request a second opinion if that will help allay any concerns or fears you have. So, Black women, there was a recent study, I can't remember which institution that spoke to this, that we experience longer times from when we have the first signs and symptoms to when we're diagnosed. And even after we're diagnosed, there's a delay in our treatment. This is unfortunate, but we can help ourselves and help those we love. So we need to speak up to avoid those delays. If we're confused or not sure or have concerns, we can ask for help to navigate the system. So that goes with having a nurse navigator or a patient navigator, somebody to help you get through the system. It's not easy. It's not easy navigating the system. Seek out emotional support from those who are there to support you. Get yourself a timeline so that you can have your expectations set and you know what you have to do. If you've read somewhere that you need additional testing or you believe you need additional testing, please speak up and ask for it. And when tests are being offered to you to be scheduled, go ahead and schedule them. Don't delay. And then again, many places have additional locations. So check to see if there are other locations available for you. The beauty of this is breast cancer is not a death sentence. There are more than 3 million survivors in the United States. So if you're a survivor, give yourself a hand. Give yourself a hand. And we do have some tips for you. So what are the tips for survivors? Don't stop getting your physical. Follow the recommendations of your oncologist. Many survivors will have side effects, so work with someone to manage those, and then follow the tips to reduce recurrence. And what are those tips? And these work for us as preventive and also to reduce recurrence. So maintain a healthy weight. That's getting regular exercise. You see a bike up there. It doesn't have to be a bike. You can walk. You can take the stair. There's some easy ways, like parking your car a little bit farther when you're going to the grocery store. And then when you get your cart, instead of putting your cart there near your car, you can walk the cart all the way back into the grocery store. So there are many ways to just get a little bit of extra exercise. And then eating a plant-based diet is extremely important. Limiting red and processed meat, alcohol, and sugar, and then avoid tobacco and nicotine products. There are other things to know. If you do have breast surgery, there are reconstructive options so you'll meet with a plastic surgeon and you can discuss those reconstruction options. Also, there are disease prevention guidelines that you can follow, and your doctor will discuss those for you. And we know that there are social and emotional impacts for patients. Many patients, when they come and they see us, they have concerns that the cancer has reoccurred. We know that. We know it's a journey, but lean on us and lean on others who will be there to support you and guide you throughout the journey. So next, we want to talk about a few resources. So these are Texas specific, but I'm sure that there are individuals who are not necessarily in Texas, but we'll kind of, let's just talk about them as we go through it. So United Way is not just in Houston. United Way is national. The Rose is in Texas, but it is a free to low cost center for breast cancer, not necessarily breast cancer, but breast patients. So in many cities, there are resources like this. There's Texas Cancer Information for your state. You just switch out Texas and put your state in there. And then you can always reach out to us at MD Anderson. You can always go to our website for valuable information. Always, we're there. When you're diagnosed and you need treatment, again, you can reach out to us. That is our phone number there. It's toll free. Lyndon's Bain Johnson Hospital is our county hospital in Houston. Again, there's Texas Cancer Information. Just replace Texas with your state if you don't live in the great state of Texas. And then Komen also is nationally known. So there's help for you. What about for survivors? Again, you can go on the MD Anderson website for survivorship. There's the My Cancer Connection. And then for each state, there is information for cancer survivors. There's information out there, my friend. So thank you so much for being with me today. But let's review. We as Black women have higher death rates from breast cancer, but we can do something about it. And what we do is we know our risk and we modify our health behaviors to save lives. We need to know what our breasts look and feel like, and we are not powerless if you get a cancer diagnosis. More than 3 million breast cancer survivors in the United States. So it's not a death sentence. You can survive and thrive after having breast cancer. So this is a QR code for MD Anderson. So you just put your cell phone up there. And we're so happy to be here today. And I'm looking for my t-shirt in the mail so that next time I can represent properly. But I do have my pink on for Breast Cancer Awareness Month. So thank you very much for this wonderful, wonderful opportunity to present.
I appreciate all that great information. What was really interesting to me is that I didn't know that breastfeeding helps with preventing breast cancer. So that was, I think, and it's so interesting because a lot of Black women don't breastfeed, and I don't know if that's a cultural thing, but my mom didn't breastfeed me, and it just doesn't seem like it happens a lot in our community. And maybe it's happening more now with more awareness about breastfeeding and how healthy it is for the mom and for babies. But I did not know about the link with breast cancer at all. So that was very interesting.
Absolutely. It's wonderful for the mom because with having being pregnant, there's the whole hormonal cycle, and then with the letting down with breastfeeding, it's just wonderful to take care of the hormonal side, if you will, of breast cancer development. And then when we think about the baby, with babies, it helps their immune cycle, and there's some papers that suggest that it also helps the brain, and then also the emotional development of the babies as well. So it's just, I mean, it's amazing. It's just good all around.
That's a very good note. Very good note. I'll remember that whenever I'm expecting again. So thank you so much, Dr. Mosley. I appreciate you. Thank you for being a part of the Black Girl Health family today. And thank you again for MD Anderson for supporting our mission. So have a great day. Have a great weekend.
Thank you. And I have to thank Jeanette again for being so gracious to me, for helping me with the slides. She's amazing. So
thank you, Jeanette. Awesome. Thank you again, Dr. Mosley.
Thank you. Bye.
All right. So I hope everyone is enjoying what they're hearing and is learning, is definitely learning. So we have another testimony for you from a survivor. And so I want to play that right now.
Hello, everyone. My name is Felicia Pichon. I'm the Executive Director of Sisters Thrive, where we educate women about breast health and early detection because it literally saves lives. We encourage them by sourcing resources, and we empower them to thrive and not just survive. Hello. I'm so excited to be able to share my story with you and my journey. It is a gift from God, and I am grateful for the process and the journey, y'all. I'm grateful that God is a deliverer. I was diagnosed with breast cancer in August of 2021. I am almost a 2-year survivor. I had my surgery in November of 2021. So I'm coming up on my 2-year anniversary of my surgery. I am elated to be in this space to educate and amplify our voices in the breast cancer community. When I was diagnosed in August, I went to a breast cancer event in October. That October, because I had breast cancer. And when I realized that we are 40% more likely to die than our counterparts, and in Houston, Harris County, where I live, every other woman that dies from breast cancer is Black. When I heard those statistics, I was like, had I heard it before I had breast cancer, I'd have been like, man, that's really sad. Hearing that with breast cancer, I was like, we have got to bring about a change. And health equity is the key. So I am out here in these streets saying, check your breasts, know your body. It's like self-care, taking care of yourself, which is the number one priority. My cup runneth over. Everything in the cup is for me. The overflow is for everybody else. Ladies, I say take care of yourself. Make your health a priority. Get your regularly scheduled mammograms, but if you're too young, check your breasts. Check yourself monthly. Make it a part of your self-care journey. You go get your nails done, you go get your hair done, all of that. Check your breasts. First of the month does it for me. First of the month, 15th, whenever. But make sure you check your breasts. You know yourself. you take care of yourself, and you are a priority. I'm so glad to be able to have shared a couple of little tidbits with you guys. But hit me up at www.sistersthrive.org because, baby, you are priority. And the thing I love to say is that we thrive and not just survive. And that is a different skill set.
All right, we thrive and not just survive. I love that. That was epic. Thank you so much, Felicia Fashawn, for giving us that motivation, those motivational tips. So we're gonna head right into a commercial, and then we're gonna come back with something upbeat. We're gonna come back with Zumba because this, again, it's not a somber day. This is a celebration. This is a celebration of survivors. This is a celebration of resilience. And so we want to end with something that is upbeat and something that you can really feel and be motivated by to end our workshop. So stay with us. We'll be right back with some Zumba.
Feel like yourself again. The mother, the lover, the friend. Feel like yourself again, not tired and exhausted and at your wit's end. Feel like yourself again, having fun, loving yourself and others. Feel like yourself again. It's time to heal and live. If you or someone you know is struggling with their mental well-being, book an appointment today at the BGH Clinic for Women's Health, a safe space for women of color to take control of their mental well-being and feel like themselves again.
All right, we are now about to kick it off with some cardio and strength with the Danae Ward. So Danae, take it away.
Hey, all right. Everybody, happy Saturday. First of all, I love the theme, the resilient bodies, resilient souls. Love it. And I think that as Black women or women of color, we're always talking about how we need to be resilient, right? After trauma, after things happen in our lives. So lovely theme. I'm here to do a little bit of movement, which is very important. You know, minimum of movement should be 150 minutes per week. That's 30 minutes a day. So when we talk about building strength after surviving something like cancer, we want to ease into our movement, right? Things that we could do all the time. Thinking about physical activity. So I don't use the word exercise because that could be different ways that we're moving our body. So I'm going to get started, just a little warm up. I do have a dumbbell. So, you know, that's something, if you do have something like that at home that you could access, but all of this is body weight. That's just like, if you want to do a little external load, but yeah, we're just going to get started. Yeah. So I have my mat down, find a nice comfortable position. And we're going to start with just kind of rolling the shoulders back. Yep. Just breathing, inhale, exhale, roll the shoulders back. That should feel really good to loosen up a little bit. Yes. Good. Breathe. And now give me like a little rotation here. So I'm going to rotate. And as you can see, I'm turning that leg in and I'm reaching opposite side to side. And this first part is really just to get some warmth in the body. We're keeping the core engaged. So hopefully y'all are moving with me. Yes. 4, 3, 2, and 1. Give me a big inhale here. See, I'm nice and wide. Inhale, reach up. We're going to exhale, bend for me. Yes. So like a little wide plie. Inhale, reach up. Exhale when we bring those arms in close to the body. Again, inhale. Exhale. Inhale. And exhale. Good. Give me a little march in place here. So what we're going to do is simple movements. I'm going to give you modifications. I'm going to give you ways that you can progress that movement. So it's up to you. It's whatever you're feeling in your body today. All right? Good. Now give me side to side steps. Good. And see, I'm going to let those arms come forward. When we incorporate like more and more parts of the body, that's when we get that heart rate up. Okay? Side to side. Good. Now take that leg back. Yes. Good. Tap it back. I'm still letting the arms swing. Good job. Good job. Good. One more time. Inhale. Exhale through the mouth. Again, inhale. And exhale through the mouth. Good job. Good job. All right. Shake it out. First things we're going to do, we're going to go into some cardio movements. So really get the heart rate up before we go into that sprint. So the first thing, I'm going to step out side to side. So this is my modification for a jumping jack, all right? So, you know, maybe you're like, I'm feeling jumping or I don't want to jump. That's fine. You can keep it here. So I want everybody who's going to keep it here, you do that. Or maybe somebody wants to give me a jumping jack. Yes. Core is tight. I'm breathing. Good. So it's up to you. Side step or jumping jack. Good. We're going to count down here. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. March it out. Woo! Should be feeling it, especially if you're doing those jumps. Should be feeling it. Yes. All right. Next one, we're going to tap it out now. Tap it to the side. So as you can see, I'm at a diagonal. I'm using those arms, and I'm tapping that leg back. Yes. Good. 8, 7, 6, 5, 4, 3, 2, and 1. Now take that same leg, and we're going to bring that knee up. Good. So you're giving me chambers here. I'm pulling it into the core. Squeeze. 8, 7, 6, 5, 4, 3, 2, and 1. Whew, got to do the other side, right? Here we go. Start to tap it. And if the arms become too much, you're here. That's fine. I'm at that diagonal. I'm tapping it back. Yes. Good. 8, 7, 6, 5, 4, 3, 2, and 1. Now give me that knee. Give me that chamber. We're going to drive that knee in. Yes. 8, 7, 6, 5, 4, 3, 2, and 1. Good job. March it out. March it out. Almost done with the cardio part. Good. Now, front knees. This is another thing. You don't have to do high knees. You don't have to jump. We're just alternating the knees here. Alternating the knees front. Yes. Good. Now can we take that to a front kick? Yes, I'm going to turn to the side. So you see what I'm doing is hip height, front kicks. So that heart rate should be up, right? Yes. Good. 3, 4, 3, 2, and 1. Good job. March it out. March it out. Yes. Roll it out. Do what you need to do. Hopefully that heart rate is up. You're nice and warm. We're going to go into our strength part. So once again, remember, If you got a dumbbell or a canned good or a gallon jug of water, that's good for external load. It's optional. So I'm gonna put that there. Make sure you grab some water too. Get some sips of water. And we're gonna do 6 strength exercises. The first one, old-fashioned squat, feet hip width apart, and you're gonna sit back into that imaginary chair. Or if you have a chair, feel free to use your chair as well. Just sitting into the chair and coming back up, driving the hips forward. Send those hips back, knees behind the toes, and give them up. Can you give me 10? I think you can. 10, 9, nice and deep, yes. 8, 7, good job, good job. Wait, nice and even on both heels. 6, 5, 4, 3, 2, and 1. Good job. All right. Upper body. We'll do lower upper body. We're going to do arm reaches. I want you to ball your fist. See, I'm starting at a nice 90-degree angle. Extend. Let's alternate it. So remember, if you have like 2 dumbbells or 2 cans, just something for external load, that'll give you a little extra, right? A little more for your shoulder press. Good. Reach. And every time you reach, you're going to exhale. And you're going to keep that core nice and tight. Yes. But you're fine with no weight. You just ball that fist and reach it up. It's all about moving the body different ways. 8, 7, 6, 5, 4, 3, 2, and 1. Good job. Grab some water if you need to. So this next one, working the hamstrings. I am going to use my dumbbell, but feel free to just interlock the fingers here. I'm going to turn to the side, feet hip width apart. So for an RDL, we're going to hinge forward from the hips. Nice soft knees, shoulders relaxed. Take it down, drive it up, squeeze at the top. Take it down, nice flat back, squeeze at the top. So now you should feel the back of the legs. So those squats were for those quads and those glutes, right? So now we're doing a little bit of glutes, a little bit of hamstrings, back of the legs. RDL, yes. Take it up. Core is nice and tight. Ooh, I'm sweating. Are y'all sweating? I hope so. Definitely want to break up the sweat. Good. Take it down. Bring it up. Give me 4 more. 4, 3, 2, and 1. Good job. All right, we're going back to upper body. We're going to stay in that position where you're in that nice flat back. We're looking straight out, shoulders relaxed, ball the fists and slightly bend the elbows. And we're going to take it to a fly, arms out to the side and bring it in nice and controlled. Squeeze and bring it in. Yes, squeeze. Once again, so imagine if you had those dumbbells, going to give you a little extra on that fly. Yes, this is for your back. Bring it in. 8, 7, 6, 5, good. 4, 3, 2, and 1. Good job, good job. All right, we're almost there. We're almost there. Going back to lower body. So we're going to modify our lunge. So this is up to you. How far you want to extend that leg back. That is up to you. So you don't have to do a wide lunge. You can stay here and just pulse it. So that's what we're going to do. Your hips are square toward that front leg. You're going to take it down. Straight down and up. Watch that front knee for me. Make sure it's not going past the toe. Straight down. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Good job. All right, switch. shoulders relaxed. Yes. 10, 9, 8, 7. To feel that quad. 6, 5, 4, 3, 2, and 1. Good. March it out for me. All right, let's just walk it out a little bit. And speaking of walking, walking is one of the best weight-bearing exercises. Give you cardio and resistance. All right, walk it up and walk it back. It's one of the best things you can do. So even if you're just doing a moderate or a brisk walk, yeah, or you can walk to music, take it side, take it to the other side. Yes. Good. One of the best things you can do is put on some music and just walk. And think about different ways that you can move your body that's going to give you joy, right? Think about joyful movement as well. Bring it up. We don't talk about joyful movement. That's also physical activity. Those fun things that we do to keep us going. Maybe you're at a festival and a band is performing, you know, and you're just moving to and grooving to the music. That's physical activity. That's moving your body. That's exercise. All right? Okay. So now we got one more straight exercise. Actually, two more. We're going to do a combo. Combination. We're going to combine our squat into our press. So we have one squat, nice and deep, and then reach the arms up. We inhale here, exhale up. Good. Exhale up. 10, 9, 8, 7, good, breathe. 6, 5, 4, 3, 2, and 1. March it out. Good. March it out. Yes. Again, walk it up. Once again, that joyful movement also could be you just playing with your children or playing with your grandchildren. That's moving your body. That's physical activity. Side to side. Good. What's another thing? Yard work. Some people like being in their yard, right? That's definitely a workout. I know if you're in my household chores, it's a workout. Good. You got to think of different ways you can sneak in that movement. Walk it up one more time. Tap. Good. Yeah. All right, y'all ready for the next combo? The next combo, march in place. We're going to get back into that RDL and add a row. So I'm going to do this from the side. You're going to take it down into that RDL, row with the elbows back, and then bring it up. That's your combo. Down, squeeze. Bring it up, down. Get that back, elbows back. Bring it up. 10. Good. 9. Yes. 8. Come on, you got it. Yes. 7. 6. 5. 4. 3. Good job. 2. Last one. Yes. March it out. March it out. Good. Easy work. Easy work. Walk it up. Good. I'm crossing the arms. Walk it up. Good. This time, can we do a little grapevine? So we're crossing behind. Yeah. We're still walking. We're still walking. Crossing behind. Good. Just a little cardio in between that straight. Yes. Cross. Good. 4, 3, 2, and 1. All right. Last combo. We're going to add those lunges. So, lunges with upper body. I'm going to get into that lunge position. And now, ball your fist and you're going to squeeze like you're doing a bicep curl when you go down into your lunge. So, looks like this. Squeeze. release. Yes, bicep curl. Feel free to grab your dumbbells if you have them on this exercise. Good. Give me 10, 9, 8. What are the benefits of doing multiple muscle groups at one time? That's 7, 6, 5. Moving more muscle groups, burning more calories. Come on, 3 more. 3, 2, and 1. Good. Same thing other side. Yes. Same thing other side. So switch. Oh, yeah. Make sure I'm on the right foot. Good. Getting into that lunge position, shoulders relaxed. Bicep curl when you lunge. Here we go. So I love combo exercise because sometimes when I don't have a lot of time, let's say I have 15 minutes, give me 10. I just want to get as many muscle groups in as I can, right? So that's a good thing about combos. You got 5 more because you're moving the upper and lower body. You're getting that heart rate up. 4, 3 more. 3, 2, good. And 1. March it out. Now march it wide for me. March it wide. Good. So getting those knees up a little bit. And that's going to get the heart rate up too. Yes. March it nice and wide and really pick those feet up if you can. Good. So heart rate should be up. We're going to cool it down a little bit. 10 more. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Big inhale. Exhale. Let's get the heart rate down a little bit. Yes. Inhale. And exhale. Should be sweating a little bit, right? One more time. Inhale. And exhale. Good. Let's cross that leg over. Reach it over a little bit for me. Yes. Nice lateral stretch. And other side. Cross it over. So movement after surviving, after trauma, after lower back stretch, let's take it down, is focusing on what you can do. Let's roll it up, 1 vertebrae at a time. Again, take it down. And roll it up, 1 vertebrae at a time. Good. All right, grab some water. We are going to connect to the mat. We have just a few more exercises. I'm definitely going to grab some. So like I said, we're focusing on what we can do, right? Everybody is going to start at a different level. Maybe you were really active before this happened, or maybe you're just starting. The good thing about movement, never too early, never too late to start. On all fours, if you may. Hands directly under the shoulders, knees under the hips. Good. And if this is too much, feel free to grab a blanket or towel to kind of support the knees. If you need a little extra support. And I want you to inhale, tuck the tailbone by arching the back and lifting the chest. And on your exhale, round the back like a cat. Drop the chin into the chest. Good. So we're going into a little slower movement, a little yoga, some stretching. Inhale, arch. And exhale, round the back. Yes. Good. Oh, but you know, we might as well hit the glutes, right? Since we're in this position, bend that left leg for me, or that leg that's facing the camera, and let's take it out and bring it in without touching the mat. Some fire hydrants, just a little bit for the glutes. We talk about building strength and building stamina, right? That's all about what we're doing too, to engage that core, which is our foundation. So hips are square, shoulders are square, and we're gonna take that out to the side. And maybe you're just gonna do 4 reps here. Maybe you can do 8. Notice I'm not counting. I just want you to do as many as you're comfortable with. Breathe. Good, and let's try the other side. Taking it out to the side, bring it in without touching the mat. Good, really good for the glutes. I know you feel that in the glutes. Really good for the core. And remember to breathe. Good job. Now from here, what I want you to do is sit back into an extended child's pose. We're going to sit hips toward the heels and extend the arms out. So you're in extended child's pose position and release. Breathe. We're starting to get the heart rate down. Maybe you need to rock from side to side. Release the shoulders. Release the lower back. Good. One more time on all fours. One more time here. You're going to inhale, reach up. This is a really good strength exercise. And then take it through, thread it through. Again, inhale, reach up. Exhale, thread it through. Good. And as a matter of fact, I'll turn to the front so I can make sure that you can see what my arms are doing. Yes. I'm looking up. Reach. You should feel that in the back, in the shoulders. It's a really good one you could do right at home. It's amazing how our bodies can be our machines. Sometimes you don't need external load. Just using your own body weight to build that strength and build that stamina. Reaching up. Good. Here we go. Let's try the other side. Inhale, reach up. Yes. Thread it through. Good. Maybe that feels good. Some of y'all like, oh, I haven't stretched in a minute. And that is feeling really good on my spine. Up. Good, good. Yes. And once again, get back into that extended child's pose position. Hips to heels. Release the lower back. Reach with the fingertips. Good. Find a nice seated position. So facing me, nice and comfortable. Yes. Nice and tall on the sit bones. We're going to open up the chest. Start to breathe now. Take a little time. Let's tilt that head toward the shoulder. That should feel good on the opposite side and the other side. And speaking of twisting, inhale, reach up. Let's exhale, twist and look over that shoulder. And reach up. Exhale, twist, look over that shoulder, other side. So even if you start off like this doing yoga, come back to center, roll the shoulders. Start off by just stretching the body. That's still moving the body. That's still using your body weight. Good. Let's stretch out the shoulders here. Crossing over. And other side. Good. Open up the chest here. Interlock the fingers. You can stay here. You can hinge forward if you want to open it up a little bit more, a little deeper. It's up to you. Yes. And reach it out to the side. Give yourself a hug for your hard work, your resilience, your determination. I love what the lady said in the testimonial about thriving. That's what we're doing, not just surviving. So give yourself a hug for that. And of course, for engaging in this movement today and joining me, please reach out if you have any more questions. I appreciate you all having me, and I hope that you incorporate some of these movements moving forward. Thank you.
All right. Well, thank you so much, Danae. I appreciate that workout, and I thank you for, ending our session, our workshop series in good spirits.
Yay!
Good spirits. And so thank you for being a part of the Black Girl Health family today, and such an important topic, being able to support that. So thank you again.
Yes. And also, I wanted to say, in terms of resources, when it comes to movement, there is a free program called Live Strong, usually connected with YMCAs, but it's national. So just look it up. You don't have to be a member. If you see that they have Live Strong, it's a free program for cancer survivors to get them movement, to get back into movement, building stamina and everything. So just a FYI.
Yeah, that's strong. Okay, definitely. Thank you. Thank you. Thank you. Thank you.
You're
Well,
welcome.
Danae, have a great day. And thank you again for being a part of I'm a Survivor.
Yes, no problem. Thank you.
All right. So that ends I'm a Survivor this year. I thank all of you for joining us. We definitely moved and grooved. We had a moment of peace with yoga, and we learned a lot about everything we need to know about breast cancer prevention and treatment with MD Anderson. Again, I would like to thank MD Anderson Cancer Center for supporting us. They have supported us every year, so thank you so much for that. I hope you guys learned a lot. I hope that most of all that you learned that, you can still thrive. You know what I'm saying? You can still survive, through, whatever obstacle or challenge that you may face, whether it be, breast cancer or any chronic illness. There's always a way, there's always hope, and there's always faith. So we're going to leave on that note. Thank you all for joining I'm a Survivor, and I'm Portia Grigsby.
Yourself again, the mother, the lover, the friend. Feel like yourself again, not tired and exhausted and at your wit's end. Feel like yourself again, having fun, loving yourself and others. Feel like yourself again. It's time to heal and live. If you or someone you know is struggling with their mental well-being, book an appointment today at the BGH Clinic for Women's Health, a safe space for women of color to take control of their mental well-being and feel like themselves again.